I'm Ann Cary, professor and associate director for community partnerships at Florida Gulf Coast University in Fort Myers, Florida. Well, Diane and I are fellows in the American Academy of Nursing, and she reached out to me when she was interested in finding a partner in the Fort Myers area, Southwest Florida area. We were delighted to be reacquainted as she was telling me about the wonderful opportunity that she had been provided as the director of the Golisano Institute for Developmental Disabilities. And she was so excited about this new program that she was starting, and she wanted to know if I was interested in being a part of it in some way. Was there some way that I could contribute to the work that she was doing? I paused for a minute and I thought, wow, I'd really love to help, but I don't know too much about it, and so I'm really going to have to be on a learning curve. Being from public health, I'm very used to working with populations and communities. So I'm going to do a gap analysis for my FGCU community, trying to understand what assets they are providing for our population and where are the gaps and what are the solutions to closing those gaps in our population. So I'm really excited about the breadth of the project and the fact that starting the conversations and having discussions in open about the nature of work that we're doing with the population on campus will hopefully influence greater good for the population and for the campus as a whole. Well, one of the things that I'm really interested in on the national level is how do we get more knowledge about working with this specific population at the undergraduate and graduate level in our schools of nursing. So I'm with some wonderful colleagues in this first cohort who represent schools of nursing because the next generation needs to know how to work with populations that are so different from themselves in ways in which they can optimize their potential as they're giving health care to the population. So I'm really interested in how this is going to integrate through the curriculums that are going to be developed nationally through the American Association of Colleges of Nursing. And that's true at both the baccalaureate and the graduate level. And at the community level, I'm really interested in taking what we're learning from FGCU and determining how to build out additional partnerships with the campus in a way that the community begins to see FGCU as a resource for working with the intellectually, developmentally disabled across Southwest Florida.